Hi everybody, welcome back to our channel. I'm Roslyn. Today Efren will not be joining us, but we are going to be discussing the changes that are happening in 2025 to your Medicare plans so that you can be aware of what's coming, how to plan, and how to make sure that you can maneuver through all of the changes quite smoothly. Let's get into it. As many of you know, the federal Medicare program provides Medicare insurance for most people 65 and older and many people with medical disabilities. That said, it does not cover all of their insurance needs, and so there are missing gaps in the plan coverage, which is why we have Medicare Advantage and we have Medigap and the Plan D coverages. So let's talk about what's changing and how that affects you. Medicare Advantage plans run for 12 months at a time. So what that means is that every year, the insurance companies go through what is called a loss ratio. That's how many people they have on the books, how much money they're paying out in insurance claims, how much money they've made, and then they take all of those formularies and decide, based on those numbers, where do we have to cut cost? Where do we have to put more services? What areas are we going to expand and what areas are we going to remove from the service area? The way that you look into that is once a year, you are going to be sent an annual notice of change. That comes to you from your insurance company that you are currently enrolled with. That could be a number of companies. That could be Aetna, Blue Cross, Blue Shield, whomever it is that you have. They should already be out because they are due out at the beginning of September. If you've not received it, we're entering into October. You should have a copy of that annual notice of change. If for some reason you don't have that, make sure to call your insurance company. It's listed on the back of your card. There's an 800 number. Go ahead and give them a call. Ask them for a copy of your annual notice of change. Why that's important to you more this year than any other year is we are having the most changes in Medicare this year since Medicare's inception. Let's get into why some of those changes are happening and what they're going to look like. All right, so we have some good news and we have some bad news. The good news is that one of the major changes happening in 2025 is going to be a max cap out of pocket. So as of right now in 2024, if you were to be on a Medicare D plan for prescription drugs, you would have to pay not only the initial max out of pocket, you would also have a catastrophic stage. You hear people talking about the donut hole and all that stuff. I'm not going to get into it, but during that period, you would also have to pay an additional 5% of whatever it is that you have on your Medicare Part D prescriptions. That can become quite costly, especially if you're somebody who has a lot of medications and if they're an expensive medication and they don't have a generic available to you, that is going to cost you a lot of money. So with the new plan starting in January, what they're going to have is a $2,000 maximum out of pocket. So while that sounds absolutely wonderful, and it is, it's great if you're planning on, saying, okay, I've hit my $2,000 limit, and now I don't have to pay any more for the rest of the year. That's wonderful. The downside to that, when the insurance companies were doing their formularies and they looked through everything and they said, oh gosh, we're not making enough money here, we're not making enough money there, we got to cut things and move them around. What they've done is some of the plans are going to be increasing exponentially the cost of the plan. In addition to the cost of the plans going up, we are going to be seeing things like coverage loss in areas, not everywhere, but it's something that you need to know is happening so that when you get your annual notice of change, this of any year is the most important year that you are going to read that notice. If you happen to be somewhere where in the notice it says you might be losing coverage, the hospitals may close, the doctors may decide that they are not going to accept the plans, whether that's a Medigap or a Medicare Advantage plan. And in doing so, a lot of people are going to be very concerned about where do I go, what plan can I get into that'll give me coverage, what doctor can I see, and what hospital can I go to. So that annual notice of change that you are going to be getting, that you should already have, is incredibly important for you to review this year and make sure that you know what changes are happening. Okay, so what's in your annual notice of change? These are going to detail your deductible, copay, your coinsurance, your max out-of-pocket, your daily hospital costs. Each of these this year, you're going to want to pay attention to when you receive your annual notice of change. Not everything is changing, but a lot of things are changing. So we want to make sure that when you look at your plan, whatever you have, make sure that you are still going to have the coverage that you think you have in 2025. Okay? If you are going through it and you either don't understand it and you're not sure what to do, make sure to reach out to your insurance broker that specializes in Medicare. If you don't have one, feel free to reach out to us at Rendon Insurance. We are happy to go through that with you. It is so important this year that you understand what is coming so that you can properly prepare for that. Okay, so let's talk about the good news and the bad news. So starting in 2025, we are going to have a max cap of $2,000 annually. It's great that we are going to have a cap because it's going to help us be able to plan for the year and saying, okay, the most we're going to spend is $2,000 in the year for our Part D prescriptions. The downside to that is that the insurance companies are a business. And so they're going to have to recoup that money somewhere. Okay. So they are now going to have to take on the money that the beneficiaries, being you, used to pay toward your Medicare Part D coverage. Since that's going away, now the insurers are going to have to pick up the difference. Again, they are a business, so they're not going to just take that loss without changing things. So what you're going to see in 2025 is a lot of changes due to several different factors. I'm going to go into those with you real quick just so you can have an idea of what is prompting these changes. So we have a population that is increasing in age. Currently, we have about 50% of all Medicare recipients receiving a Medicare Advantage plan. So that means that we have a lot more claims happening now than we used to have. In addition to that, you have morbidity rates that are increasing, and it's causing the insurance companies to have to pay much more out in health insurance coverages. Some of the markets are becoming completely unprofitable for the businesses. And as a business model, they're deciding, can we stay in that market? Do we need to close the hospitals, the doctor coverage, whatever it might be in that market? Those are things that they're talking about right now and trying to figure out. Again, going back to your annual notice of change, that's why it's incredibly important that you look at that. We need to make sure, do you still have coverage coming up in 2025? Does your hospital still have coverage? Does your doctor still take the coverage? All of those things are going to be important. And I'm not saying that every single person is going to have that change and you're going to lose that, but there are going to be those that do, and you don't want to be the one that loses it and you're unaware until January and you go to the doctor and now you realize, oh gosh, I had an opportunity to make a change and I've now missed it. So it's really important that you're taking a look at those annual notices of change. Another big change that we're going to see is the pre-authorizations are going to be shortening. So currently about 70% of services require a pre-authorization. And what they're doing is they're shrinking the times down. So if you had a pre-authorization before that maybe took 2 weeks to get back, they're saying we need it back in a week. If it said we needed 3 or 4 days to get that authorization back, now they're saying we need it in 24 to 48 hours. So that's a really good thing for you as the beneficiary, that we are not going to have to be waiting for long periods of time to get these approvals to get the procedures that we need. So that is going to be another benefit with all the changes that are happening in 2025. Something else that we need to look at is that we have a lot of underutilized perks within the plans. So right now, the government gives each of the insurance companies amounts of money to offer the zero premium plans that are available, to offer gym memberships or glasses or dental work or a lot of different plan bonuses, if you will. Well, the problem is that not everybody's utilizing those plan bonuses. And so it's being paid for upfront by the government and it's not being utilized by us, the beneficiaries. So what the government has now said is that we need the insurance companies to notify you midway through the year. Just a reminder notice that it'll be coming out. It's going to be called a mid-year benefit notification, and that's going to start in 2025. It's not something that we've seen before. That's going to tell you if you have benefits that you're leaving on the table. So if you have dental or glasses that you need or a hearing aid, if you have not used all of your benefits, then what that gives you time to do as the beneficiary is to go through and say, actually, I still want to get my glasses, or I still need to get my dental work done. And it gives you 6 months to still make those changes and put that into place. Because what we don't want is to have unused benefits. And so the government has now said to the insurance companies, we require you to remind people that halfway through the year that you still have benefits that are unused, and let's get those taken care of. So no matter your situation, be sure to reach out to either your insurance broker or Rendon Insurance so that we can make sure that you are taken care of coming into 2025. Because like we said before, in 50 years of Medicare history, we've never seen changes like this happening, and we want to make sure that you're taken care of in the new year. Thank you for spending time with us. If you have questions, please reach out, and we look forward to talking to you again real soon.